Welcome to the Deep Dive. Today, we're looking at something incredibly serious. You've brought sources detailing a major public health and, frankly, security emergency in Sierra Leone. It's all centered around a synthetic drug called Kush.
That's right. And the material we have, particularly a really powerful piece by Chernor Juldeh Bah, doesn't mince words. It calls what's happening a silent genocide.
Wow, silent genocide.
Yeah.
That's incredibly strong language.
It is, and it's deliberate. It signals we're way past talking about just, typical drug problems. So our mission today is to unpack why. Why that term? What is this chemical threat? What's the real human cost? And crucially, what needs to be done according to these sources?
Right, so when I first read that phrase, silent genocide, it really stopped me. How does the source justify using a term with such gravity?
It's about the speed and the lethality combined with who it's hitting. The source describes Kush as this cheap, incredibly deadly mix that just sort of appeared almost overnight.
Like a thief in the night, as the source puts it.
Exactly. And it's stealing a whole generation's future. The key thing here, what makes it different, is how fast it kills. Sometimes just one hit.
One hit.
Yeah. So you get this incredibly accelerated loss of life, mainly among young people. And the author sees that rapid devastation as, akin to a form of societal destruction, hence the term.
Okay, let's get into the science then, because that lethality you mentioned, that's key. What is Kush, chemically speaking? How is it different from, say, heroin or crack?
Well, that's part of the problem. It's not one single stable drug. It's a synthetic mixture, and it seems to be constantly changing. But chemical tests are showing what makes it so toxic. Usually it's a combination of things.
Like what?
First, you often find highly potent synthetic cannabinoids. Those are dangerous enough on their own. But the real kicker, the thing that seems to be driving these instant deaths, is often synthetic opioids. Specifically, the source names nitazenes.
Nitazenes. Okay, I'm not familiar with that term. For someone listening, what does adding a nitazene mean? How potent are we talking?
We're talking extremely potent, potentially lethal in tiny amounts. Some of these nitazene compounds are reported to be, hundreds of times stronger than even street fentanyl.
Hundreds of times stronger than fentanyl.
That's what some reports indicate. And they're relatively cheap to make, easy to mix into a batch of Kush, but incredibly hard to dose safely. So, yeah, a single hit can absolutely kill you. Mix that with synthetic cannabinoids, maybe other cutting agents.
Yeah.
You get something unpredictable and terrifyingly efficient at causing overdoses.
Right, so that's the terrifying chemistry. How does that play out on the streets in Sierra Leone? What's the visible cost the report talks about?
It's immediate.
Yeah.
And it's heartbreaking. The report really highlights the burden on local officials. Council teams, especially in Freetown and the surrounding areas, are basically dealing with the bodies daily.
Daily.
It sounds like it. We're not talking abstract numbers here. The report mentions scores of suspected Kush victims collected and buried just by city and district authorities this year alone.
Rare.
They're managing cemeteries, cleaning up sites.
Scores of bodies collected by municipal workers. That's a public health emergency right there. The burden on those local councils must be immense, financially and just emotionally.
Exactly. And the source makes it clear. These aren't just statistics. They're young people from these communities. So the connection is drawn very sharply. This level of death, driven by this shifting synthetic drug. It's not just a social issue anymore. It's an existential threat, a public health and security emergency.
Okay, so if it's reached that point, the response needs to be just as serious. Where does the source say the strategic disruption needs to start?
It calls for action across three main sectors working together. First, security hitting the supply chain. Second, the national government policy, but crucially, sustained funding. And third, the public health and drug control bodies focusing on testing and treatment.
All three pillars need to work in sync.
Absolutely. The author argues that without that coordination, any effort is likely to fall short.
Let's take security first. The obvious thing is arresting dealers on the street, right? Seizing the drugs. But the source says that's not enough. Why?
Because it doesn't stop the flow at the source. Street arrests are necessary, sure, but they don't fundamentally disrupt the business model. The real profit, the big money, is higher up.
So where should the focus be?
The argument is it needs to shift upstream. Disrupting the flow of the raw materials, the imported precursor chemicals. These aren't always, obviously, illicit materials, They can look like legitimate industrial chemicals. Cheap, hard to track sometimes.
Okay.
So the real targets have to be dismantling the networks that traffic those chemicals and the finished Kush, and critically going after the financiers, the people actually making the serious money off this.
That sounds like a huge challenge, especially for a country maybe without vast resources.
Right.
How do security forces balance going after these big networks and precursors while still dealing with the street level problem right now?
Yeah, that's the tension, isn't it? It's not necessarily either, but about where you put the strategic weight. The report names specific agencies that need beefing up. The Transnational Organized Crime Unit, TOCU, the anti-narcotics teams,
Yeah.
customs.
What do they need? More manpower.
Manpower, yes, but also better tools and legal backing. Things like rapid forensic testing, so they know exactly what they're seizing. International cooperation is key, too.
What does it mean, practically? Like sharing intelligence?
Sharing intelligence, yes, but also things like mutual legal assistance. So if the money trail leads outside Sierra Leone or a key trafficker is elsewhere, they have the framework to work with other countries to prosecute, to seize assets. Targeted interdiction at ports, airports. Forensics are vital because they help pinpoint who is making what, allowing prosecutions that go beyond just the small fish. And there's a really important warning in the source material here. Enforcement has to be professional and respect human rights.
Right, because heavy-handed tactics could backfire.
Massively.
Mm.
Undermine public trust, maybe even fuel corruption. Success, the source argues, shouldn't just be measured by headline-grabbing arrest numbers. It has to be measured by actually dismantling the supply chains. That's the real metric.
Okay, that's the security piece. What about the national government's role? The president declared a national emergency, which sounds like a big step.
It is a big step. It shows recognition of the gravity. But a declaration needs teeth. It needs to translate into, well, actual sustained funding and a clear national plan with measurable targets, not just a press conference and then nothing.
So what kind of structure does the source call for?
A dedicated national task force, not just a temporary committee, but a properly resourced body. It needs people from all angles. Health experts, forensic chemists, law enforcement, social services, and critically, local government reps the ones seeing it firsthand.
And this task force needs to be accountable.
Absolutely. Given a public timeline for actions and independent oversight. So everyone knows what the plan is and whether it is actually being delivered.
It sounds like funding is the recurring theme here. Getting that initial emergency funding might be one thing, but keeping it flowing,
Yeah.
that's often the hard part, isn't it?
Precisely. Which is why the policy has to lock that in. The source pushes for uninterrupted funding, insulated from, political shifts. This is a long-haul fight. It needs a funded plan. The source suggests a minimum 2-year budget covering everything from prevention to treatment. And that funding needs to be a priority.
Okay, let's shift gears to public health. Because you can't just arrest your way out of something like this, right?
Absolutely not. And this is where a key principle emerges from the sources. We cannot treat what we cannot test.
What does that mean in this context?
It means routine, systematic chemical testing is fundamental. We just talked about how Kush isn't fixed the exact chemicals, maybe the nitazenes can change from batch to batch, week to week.
And why is knowing the exact chemical makeup so crucial for treatment?
Because doctors and clinicians are otherwise flying blind. How do you treat an overdose if you don't know precisely what substance or combination of substances you're dealing with? Different synthetics might need different interventions.
Like different types of opioid reversal drugs or different dosages.
Exactly. Maybe specific antagonists work better for certain nitazenes, or you need much higher doses. So public health bodies need to be testing seized samples, testing biological samples from patients, and then importantly, publishing regular transparent reports.
So clinicians on the ground know what they're facing.
Yes. So they know what toxicology trends look like, what's causing deaths now, and can adapt their clinical response in real time. This testing is the bedrock for the next big demand, scaling up treatment.
Right, treatment. What does that scale-up need to look like? It can't just be a few beds in a hospital, I assume.
No, it has to be massive. A national rehabilitation and treatment plan. That means more hospital beds for acute detox and medical stabilization, yes. But also mobile outreach teams getting help to people where they are because many won't make it to a clinic.
And longer-term facilities.
Definitely. Community rehabilitation centers. The source stresses that just locking people up, criminalization, it doesn't cure addiction. It doesn't stop the deaths. It calls for engaging partners like the WHO, the UN Office on Drugs and Crime, UNODC, regional bodies, tapping into their expertise and resources for this kind of scale-up.
And when we talk rehab, the source isn't talking about a quick fix, right? Like a 28-day program and you're done.
Not at all. It's very clear on this. Rehabilitation can't just be a short-term thing, maybe for a photo op. It has to be a sustained, community-based continuum of care.
Meaning?
Meaning it includes the whole package, social reintegration support, helping people reconnect,
Mhm.
vocational training, job skills, trying to address the poverty and lack of opportunity that makes people vulnerable in the first place, and family counseling, trying to heal the broader impact.
Yeah.
It's about long-term recovery and stability.
Which brings us to prevention and the role of the community itself. It sounds like this can't just be left to the police and hospitals.
No, the sources are clear. The fight has to be waged in the communities. Schools, mosques, churches, community leaders, youth groups, they're positioned as the essential first line of defense, of prevention.
So empowering those local groups.
Exactly. You can't just dictate prevention from the capital city. You need to fund and support the organizations that already have trust and relationships on the ground.
What kind of specific community actions are needed? What should be funded right now?
The source lists some very practical things. Funding for early warning hotlines, places where maybe a concerned friend or parent can call, mentorship programs, especially for young people who seem at risk, livelihood projects, creating actual economic opportunities for vulnerable youth in the hardest hit areas, and public education campaigns, ones that are honest, direct, not preachy. But then the source brings up something really, really disturbing, something that just underscores the depth of this crisis.
Okay.
It calls for community patrols, not just for street safety, but to secure cemeteries,
Wait, cemeteries? Why on earth protect cemeteries in a drug crisis?
to stop grave robbing. The report mentions the horrifying reality that people are apparently robbing graves, potentially to mix crushed human bones into the drug supply.
You're serious. Human bones?
Yes, the chemical logic isn't clear, maybe it's superstition, maybe something else, but the very fact that this is happening, that it's mentioned as something needing prevention, it speaks volumes about the level of desperation and societal breakdown this drug is causing. It erodes basic human dignity.
That is profoundly sickening. The lack of respect for the dead on top of everything else. It shows how deep the moral crisis runs alongside the health crisis.
And it connects directly to another demand for a non-partisan national commission, not just focused on drugs, but specifically to oversee cemeteries, ensure dignified burials happen, and crucially support the families who are grieving, who are dealing with this unimaginable trauma.
Which leads us right to the final, crucial political point the source makes. This crisis absolutely cannot be politicized.
Yes, this is presented as the ultimate test. Kush doesn't care about your political party, your ethnicity, your social class. It kills indiscriminately. So the solution has to be unified. It demands cross-party support, uninterrupted funding.
Because if it becomes a political football?
It fails. The source warns that if every arrest becomes a partisan talking point, if rehab centers are open just for campaign photos, it destroys the common purpose needed to fight this. Priorities need to be set based on evidence, based on need, guided by the voices of survivors, families, health workers, local councils, not political gain.
So, wrapping this up, it's been a really heavy discussion looking at the source material. For the listener, what are the absolute core demands? If leaders were to act today, what are the top 3 concrete things the source insists on?
Okay, boiling it down, the source demands are sharp. First, a real, publicly accountable national plan. Not just vague promises, but clear targets, and crucially, a funded 2-year budget covering the whole spectrum: prevention, enforcement, treatment, reintegration.
Right.
Second, immediate, serious expansion of forensic testing capacity. They need to know what's in the Kush now, and they need transparent public reporting on those findings so the health response can actually keep pace with this evolving chemical threat.
Okay, plan with funding, better testing. And third,
Third, rapid, large-scale mobilization of community-based help. That means rehabilitation centers, mental health services, and real, tangible youth employment and livelihood schemes targeted right in the hotspot neighborhoods where they're needed most desperately.
yeah, numbers we talked about, councils burying scores of young people. It's just a brutal wake-up call. The source ends with a powerful challenge, doesn't it, about how this time will be remembered.
It does. It essentially asks, will Sierra Leone be remembered for the years its young people died quietly, victims of this silent genocide? Or will it be remembered as the time the nation rose up with courage, with clarity, with compassion to reclaim its children? That unity, that commitment to dignity, even in managing the dead, that seems to be the fundamental choice presented.